Thutha wa rugoria wa mutaratara wa urigitani wa UHC, thirikari cia kaunti iri na itemi inene gukinyaniria mubango uyu manyitanire na ciama cia arigitani. Mubango wa urigitani wa afya nyumbani utanyitwo gukorwo na uguni munene. Mwandiki munene wa kiama kia arigitani KMPDU DAVJI ATELA makigiana giikaro na muikariri giti wa ruhonge rwa urigitani KANJU-ini ya magavana Muthomi Njuki kwarira mitaratara ya kwandika arigitani niguo gukinyaniria mubango uyu.
We've had lots of arguments. We have seen that the county actually is doing well. We do not have many of the issues of health workforce. But in our discussions, the county has given very critical and important commitments.
We want to acknowledge that the role that the KMPDU is playing currently in Kenya is more or less working on a relationship with the counties who have the biggest health force for the health sector. And they are giving us a lot of advice that can be able to add value in how we can be able to improve our services.
Kurigana na area ya maingi ma mateta mari arigitani makoretwo namo ta kwambatirio ngathi na nyongerera ya mishara ni maundu mararumbuyanio namo.
The promise that in their budget that is coming in the next financial year they're going to see to either they increase the number of health workforce. They've also looked into the way to retain the consultants so that they can actually attract more and retain them.
The advice of employing more doctors will ensure that we have more patients, and more patients will also bring more revenue where it is applicable, and therefore it will be a win-win situation.
Hari guthaitira mirimu na kunyihia muhatekano mathibitari-ini, thirikari ni yandikite ateithiriria a arigitani aria marithiaga matura-ini magithurimaga andu mathina maria mangikorwo namo, undu uria KANJU ya magavana na KMPDU manyitite mbaru makiuria marorwo na njira igwete.
We also looked into the issues of NHIF within the county, or we call it the insurance, and the county has taken an undertaking that they're going to make sure that all these healthcare workers and workers within the county are able to access the care.
We have harmony in how we shall implement the promotions of health workforce, and also we have asked on our part that they need to continue talking to their members who are the medical doctors to continue upholding professionalism.
Mieneno yeri ni yendekithitie gukoragwo na micemanio mahinda kwa mahinda niguo guthurima makinya maria matacukitio gukinyaniria mubango uyu niguo ndukae kuremerera. Ngiribotera Kameme TV ni njitagwo Wangui wa Mwiruri.